Hello, hey there. Welcome back to I Care for Your Brain with Dr. Karen Sullivan, board certified neuropsychologist. Tonight's topic is tinnitus or tinnitus, depending on how you say it. I think I'm going to stick with tinnitus. This is the Latin word meaning to ring or to tinkle. This is a topic that was requested by many people over the last 3 years, but especially in the last 2 weeks or so, I had multiple people send us messages saying we really need to understand this topic. And turns out there's many associated risk factors with developing tinnitus, so it makes sense that it applies to a lot of you out there. This topic is very important in our community because it adds a potential detractor to quality of life. And that is exactly what we are trying to enhance in this education and empowerment journey that we are all on in this brain health community. So let's get into it. Tinnitus is a phantom sound experience. Doesn't that sound very exotic? It is the perception of a sound that has no internal or external source. Happens to about 20 to 10% of us, and is commonly described as a ringing in the ear, but that really seems like an oversimplification. The people that I know that have helped me understand what it feels like is kind of like a buzzing, a humming, a ringing, a whooshing, a hissing, a roaring, or even a cicada-like sound. And Jerry the other day reinforced that for me and said, yeah, in fact, that's exactly what mine sound like. Some people say it can happen in one ear. Some people say it can happen in both ears. Most people say it is worse in a quiet environment, specifically when people are trying to go to sleep. It's important to recognize that tinnitus is not just one thing. It is subjective. Oh, I got a nice hair in my face here. Got to get that off. It is subjective. So that means it is whatever the person who has tinnitus says it is, right? It's very personal. And this probably explains why we have not gotten very far with interventions, because like many things in brain health, if you really listen to people, what we would probably learn is that there are many subtypes, that no two brain health conditions exactly mimic each other. People bring their own unique brain into the challenge and process it and experience it in different personalized ways. So that's probably an important step. Tinnitus can develop for absolutely no reason at all, but there are factors that are highly associated with tinnitus, and that's part of what we're going to get into tonight. Tinnitus is not even the same within a given person, okay? So sometimes the person might say, you know what? It's this way in the morning and this way at night. Sometimes it's louder, sometimes it bothers me more. It is very, very subjective how it affects different people. For many people, it can progress over time. For some people, it can decrease in intensity over time. And for other people, it starts and it completely goes away. In one study that followed people with tinnitus over time, we found that 40% of people said it was relatively mild, and almost 20% of those people who reported severe tinnitus at baseline said that their symptoms ended by 5 years. So that gives you some hope out there if you're someone who is really struggling with this. We don't know why the symptoms go away in some people. The line in the sand really seems to come for how much it bothers a given person and how much it affects your quality of life or everyday function. Most people feel like they can ignore the tinnitus. They can go with the flow. For about 1 to 7% of people, they say it's really bothersome, typically described as very annoying or even maddening. Traditionally, we've thought of tinnitus as getting worse with age, but recently we've done some updates to that shows that younger age groups now, about 1 in 5 teenagers are reporting tinnitus. And we know that loud noise exposure is a very typical risk factor. And so nowadays, with the headphones that the younger people are wearing, the earbuds that go directly into the ear, probably doing some significant ear damage, hearing damage. So what does the literature tell us can be done about this condition? What is causing it? We don't want it to be a mystery. We want to empower you all with good quality information. So we don't really know the specific cause of tinnitus, but there are certainly several factors that commonly coexist with these phantom sound experiences. And the number one most common is hearing loss. So there was a very large study that was done a few years ago, and they looked at all the people that were referred to an ear, nose, and throat hospital. And what they found was 97% of the people that reported tinnitus also had high frequency hearing loss around 4,000 hertz. Sudden hearing loss typically results in sudden tinnitus. Gradual hearing loss typically results in gradual tinnitus that slowly builds, slowly becomes more prominent over months and years. The next factor that's commonly associated is dental issues, specifically as they relate to the temporomandibular joint. And part of why we think that happens is because there's a lot of connections between that very sensitive, tight little joint in there with the cochlea. Now, the cochlea is this little spiral cavity that is in our inner ear that contains something so fascinating called the organ of Corti. And these are little tiny hairs that conduct the nerve impulses into our brain that we perceive as sound. Basically, they conduct sound vibration. 18 to 27% of people who have TMJ have tinnitus, but look at this. 60% of people with tinnitus have TMJ. So there's some kind of a relationship there. You can also have issues with tinnitus because of earwax. If all of a sudden your tinnitus came about with ear pain, ear drainage, then we would get worried about an infection or maybe some kind of an allergy, inflammatory process. If people have vertigo or imbalance that comes along with their tinnitus, we start to think about cochlear issues, maybe like Meniere's disease or even migraine-associated noise perception. Migraines are fascinating. We should talk about those one day, but there can be plenty of symptoms that go beyond head pain. Just aging can be a risk factor for tinnitus. As we see in the rest of our body, there is a mild degeneration of the inner ear structures that happens over time. Exposure to loud noise is a big one. This can be music, this can be equipment, this can be explosions, this can be, loud noise, people yelling over time. We can also just inherit the tendency to have tinnitus. So we have to be mindful and inquisitive to our family members to see if maybe that's something that could happen to us. This I thought was very important information, and frankly some of this was news to me, which is part of why I love doing these lectures for you all. Is I'm definitely a forever ongoing student of the brain, always learning something. I knew a little bit about this, but I didn't know quite how prevalent this was. So there are certain drugs that can encourage the onset of tinnitus, and these are called Autotoxic medications. There are over 450 prescription medications, over-the-counter drugs, that have a toxic effect on the ear or the nerve supply to the ear, and they can trigger tinnitus, they can make it worse, they can cause new tinnitus to appear. What's wonderful is that discontinuing the medication typically leads to the resolution of tinnitus, not always. And within each drug class, there are typically a number of tinnitus-causing compounds. So I was very interested in providing you with a list, and Carrie is out there in the world. She's going to be putting on a link to a list of over 100 of these medications so you can do a cross-check and make sure that's not one of the problems. 3 of those I want to review now because they're so common to so many of us. The first medication over the counter that can cause tinnitus or make it worse is aspirin or non-steroidal anti-inflammatory drugs like Aleve, like Advil, ibuprofen, things that, I'm more than happy to take an ibuprofen. I always seem to have some ache or pain that could benefit. This happens most when we do them for a long period of time or when we, take extra doses. The effect does appear to be reversible, and I don't want you to worry if you take aspirin daily for a cardiovascular issue. That's not what we're talking about here. If you have to take a week of Aleve or ibuprofen because you've got a neck strain, that's not what we're talking about. We're talking about folks who take these things daily at high levels over a long period of time. The next type of medication associated with the onset of tinnitus is loop diuretics. So the most common is Lasix. These are commonly prescribed for things like swelling in the legs, heart failure, or to lower blood pressure. They absolutely go along with ringing in the ear and hearing loss, but this typically happens if you have to take Lasix at, a very high dose, if you have to take it through an IV, or if you have acute or chronic kidney issues. Remember, that's one thing I always promote is talking to your doctor about chronic kidney disease. It's something that is so common as we get older. We typically don't give patients feedback if they're in stage 1 or stage 2 because it is so common. But it's important for you to know because it means you're not clearing out your prescription medications like you would if you didn't have any kidney disease. The third one is a class of medication called benzodiazepines. not so much when you're taking them, but when you withdraw from them. So these are things like Xanax, Valium, Ativan. We definitely know they can be life-saving and very helpful for short-term anxiety, short-term sleep problems. The issue becomes when folks try to get off of them. So in an effort to try to minimize that or reduce that, what we really recommend is that folks take quite a long time to taper off those drugs. So even something like 3 to 6 months, very important to work with your doctor to do that on a very, very, very gradual basis. Now, the relationship to drugs and tinnitus all depends on things like the dose, how long you took them, your kidney functioning, like I said, how many other drugs are you using that might have hearing implications, your age, if you have any pre-existing hearing loss, if there's any genetic predisposition. There are also medical conditions that go along with developing tinnitus, things like metabolic disorders, hypothyroidism, hyperthyroidism, anemia, blood vessel disorders like blood pressure, high cholesterol, mental health issues, depression, anxiety, stress, tumor-related issues, things like acoustic neuroma, vestibular schwannomas, things that are very rare. What I was most interested in my literature search was looking at traumatic brain injury and stroke, because I know so many of you out there are in those communities and you want to know, hey, is this related to the things I'm hearing in my ears? Well, turns out that traumatic brain injury, especially when it is caused by shock, anything like a blast, a fall, a car accident, anything where there was a mechanical injury to the brain, you're likely to have damage to the auditory processing sections of your brain. And what we think is that tinnitus has two distinct time phases. The first one is the acute injury, and then which typically can happen in the ear. And over time, it becomes a brain issue. And I'm going to explain that a little bit more later. Tinnitus is extremely high in our military and veteran population. We actually think about 60% of our veterans have tinnitus and is most commonly associated with TBI. Now, I want to tell you, there's not a lot of literature out there. I could not find one article that talked about a type of brain injury, specifically where in the brain there was an injury that related to TBI. It's very kind of loose out there. There's a little bit more information on stroke, and there was some case reports, which mean a doctor found something interesting about a person with a stroke and tinnitus, and they wrote it up and put it in the scientific literature. And what they talked about was that it was more common in patients who had a stroke related to hypertension or high blood pressure, or there was also one where a woman had a cerebellar hemorrhage and the initial symptom of the stroke was tinnitus. So it sounds like it can either be a presenting symptom that comes along right when your stroke hits, or over time it can also be something that develops because the auditory section of your brain is not getting enough stimulation because there's been some damage to the auditory organs or the auditory cortex. The final associated factor we're going to talk about tonight is stress. How many of us have very high stress? So folks who have panic attacks, anxiety, depression are much more likely to develop tinnitus. Now here's what's interesting. Are they more likely to develop it, or are they more likely to be so bothered by it that they go tell the doctor about it? That's one of those analytical things you always have to think about with scientific literature. Who are the people that they're actually analyzing and writing up? There is a definite debate in the literature about, is stress or anxiety kind of a chicken or an egg, right? Because if you have tinnitus and you're bothered by it, you're one of that 7% who's bothered by it, you're damn right that's going to make you depressed or anxious. If it's driving you crazy, you feel like you can't get to sleep at night. Many people complain that their tinnitus gets worse after a stressful event. So my interpretation of the literature is that it probably has some kind of mechanical cause at the level of the ear. And when people are very stressed, they are focusing on it a little bit more. It's just kind of one of those things in the environment that we become very sensitive to. We're going to pick up on that topic in a few minutes. Tinnitus changes brain networks, okay? So any type of injury in the brain results in one common core symptom, which is increased sensitivity in the senses. So we see that folks who have any type of brain injury become more sensitive to hearing, right? You just feel like, are people talking so loud? Why is this so overwhelming? Plenty of people tell me, I love my grandchildren to death, but I can't stand for them to come over because they're too loud, they're too overwhelming. So over time, this can really negatively affect people and your quality of life. So there was a study that was done at the University of Illinois where they looked at people who were really complaining of tinnitus, and what they found was that they were actually very, very attentive, almost attentive to the point of being hypervigilant, which is one of the core symptoms we see in post-traumatic stress disorder, meaning kind of constantly scanning your body, don't feel at home and safe in your body, kind of always on alert. And we've talked about this in the context of stroke, kind of feeling like a sitting duck for a second stroke and how traumatizing that can be, never getting to kind of slip into that ignorant bliss that you knew before the stroke. So a very similar thing can happen with something like tinnitus. So what we think is behind that is that the brain always has something to focus on, and it can never really go into what we call the default mode, or basically the relaxing mode. Your central nervous system is just always on, because that tinnitus is kind of calling its attention over and over again. And what this leads to is mental exhaustion. If you have tinnitus and it has bothered you, it is exhausting. I am here to validate that for you, because you are not given a chance to not be attentive 24 hours a day. It can be very bothersome because when we are not able to relax, we can be irritable, we get fatigued, right? We never have that rest and restore time. We're always kind of giving. Many people who have chronic tinnitus report that they get used to it. It's a background sound. They get used, they're able to ignore it. But like I said before, it interferes with sleep most frequently. Some people even say, I don't want to go out. I don't want to be social because it's so distracting. I don't really feel like I'm all there. There's multiple theories regarding that underlying cause, but we really don't know. So I was saying before, it's kind of a two-step process where there's probably some kind of injury either to the peripheral or central auditory system at the level of the ear. And then over time, what we get is an increase in spontaneous firing, suggesting some kind of injury has happened to the brain. And this typically happens, we think, in the midbrain and in the auditory brainstem. So I know some of you are listening who have had brainstem issues. I would be curious to know if you've had that experience of tinnitus, because the literature is kind of suggesting that, but I just don't think enough work has been done on it. So what we typically see is that people who have had different types of head injuries, this is one of the more common symptoms that they are coming in reporting to us. So if this sounds like you, if you have some one-sided or double-sided noise that is bothersome to you in some way, I want you to take it serious. So what is it that should be your first step? The first step always starts with a good assessment, right? That is your map. That's how you know what this is and where I'm going. I would really recommend a trained audiologist for you, or some kind of other hearing health professional. They have the tools, the clinical protocols to help figure out what exactly is going on here. Remember, the most common associated factor is hearing loss. And when I start to tell you for recommendations what you can do, that hearing loss is going to make a lot of sense. A part of a good tinnitus workup should be asking you about your subjective experience. Somebody should want to know, how do you experience this? How does it get in the way? How is this affecting your quality of life? Because it's subjective. So please, I hope if you find yourself a good hearing professional, I really hope that they make a point to really prioritize what is your subjective experience. A medical doctor can help understand if there's a medical condition that's going on. They know about these medications that cause tinnitus and hurt hearing. And hopefully, if there's something that's identified, then you should be good, right? Here's what it is, and here's how we're going to slowly try to, in a safe way, get away from it, distance it from us. There are other techniques, even if there's no cause for your tinnitus found, there are recommendations and things that people can do. The most important thing is to assess and treat hearing loss. That is, in the literature, what you will see time and time again. The biggest complaint people have is when they go to a hearing doctor, they are afraid that the tinnitus is a sign that there's some kind of other terrible thing happening, either with their mental health, they're going crazy, they're going to go deaf, or they think, I have a tumor, there's something, terribly wrong. So the first thing is to educate people about tinnitus. Here's how it starts. Here's, there's a good chance it could spontaneously reduce over time. About 70% of people who went to a doctor about tinnitus were not offered any type of therapeutic assistance, and that is unfortunate. There have been many different clinical trials about medicines to see if that works, and unfortunately nothing has really made the grade. So they've tried antidepressants, anti-epileptics, and basically the support has come out as low. They really looked into antidepressants a couple years ago and just didn't find that it was systematically helpful. There has been some talk about gabapentin helping. This was proven much more in animal studies. Unfortunately, when they took it to human beings, they didn't find that it was consistently effective. It was helpful for some people, but not for others. But again, remember, at this point in science, we are putting all people with tinnitus into a box and saying, you have tinnitus and this is what it is. Perhaps the truth is that there's subcategories of people, and maybe that gabapentin works specifically for one subcategory. So if I were you and I was bothered by this, I would bring that knowledge to my doctor, and it's something you could certainly try. There are no clinical guidelines for medication at this time. There's no vitamins, there's no herbal supplements. Ginkgo biloba is probably the most prescribed for tinnitus, but there have been systematic trials that have not shown any benefit for alleviating tinnitus. Besides getting your hearing loss identified and treating it, so correcting hearing loss, the next most helpful recommendation, I believe, is to mask the noise with something called acoustic stimulation. So many different forms and volumes and intensities have been used to treat tinnitus. I mean, really even going back centuries. And what we think is because this is filling in the noise for the brain of those high frequencies that it cannot perceive any longer. So the idea is you're giving the auditory cells in the brain stimulation when it's not getting that from sound, and that way it doesn't have to create sound to stimulate itself. How intense and interesting is that? So really you can use any type of noise that you want at any volume. If you were to work with an audiologist, what would be cool is they could help you understand the specific decibel or hertz that you're not hearing, and you could ask them, what would be a recommended noise? What would be a recommended sound? How loud should I listen to it? How close to my ear should I listen to it? They should be able to help you match the specific frequency that you're not hearing naturally. And the idea is it takes the reason for the brain to create sound away. I think that's very interesting. Like all things that happen to us, very often figuring out how we feel and how we judge and how we label what's happening in our body can also be very helpful. So remember before I said the brain can become very attentive to the noise, almost fixated to where it can't get off of it. This unfortunately makes the sound worse and probably perpetuates it over time. So there have been attention training programs where they try to specifically get people to not focus on the tinnitus. They do this typically with video games or some kind of sounds in the environment that are so compelling that the brain can't help but focus there, so it takes the focus away from here. There has been one randomized trial that looked at adults with chronic bothersome tinnitus, and what they found was the greatest benefit was a hearing aid designed specifically to compensate for their hearing loss, but one that also was equipped with a sound generator, and that is just absolutely amazing that they have that. So go to an audiologist. If you got hearing loss, see if they can add a sound generator and it can cancel out the tinnitus. Cognitive behavioral therapy can be helpful if you find yourself having global negative thoughts about your tinnitus, waking up and feeling like this tinnitus is just making me lose my mind. CBT would tell you to wake up, you can't jump to conclusions. You don't know if it's going to be a good day or a bad day. You want to take that control back for yourself and make sure you're being mindful of your thoughts. There has been some experimental work with TMS called Transcranial magnetic stimulation. And the idea is you can put strong magnetic field impulses on the scalp, and this will help electric currents come into part of the brain that aren't getting their own blood supply and chemical and electrical activity. So it's worked in some individual studies. There's not been a randomized trial, so it's really hard for us to know exactly how to interpret that, but that would be something helpful to talk with about your audiologist. There is something called the American Tinnitus Association, and I thought what was so nice about their website, which is ama.org, is that they have a free helpline, an answer line, where they are experts in tinnitus. Always try to find the most expert person you possibly can, right? You want to see someone who tinnitus is their bread and butter. It's just like what we would say to somebody who has Parkinson's disease, right? You don't want to see just a neurologist. you want to see a movement disorder neurologist, okay? So in this instance, I know some of you get hearing tests from your primary care doc. If you have tinnitus, I would say that's a good enough reason to go see a specialist. And a specialist would be an audiologist, perhaps an ENT doctor. But you want to find the person who they keep up on the literature. This is their jam. They just love tinnitus because they're going to give you education and options. Knowing exactly what to do is half of the battle. That's really why we are here together on this Facebook page. Remember I said before that stress can often trigger tinnitus, can make you more aware of it, more mindful. This is just another reason to take stress seriously. So many of us are chronically stressed and there are effects, but we're so used to them that we're just not even aware of how they are negatively affecting us. So really prioritizing relaxation. The nervous system needs long stretches of calm, safe experience to be able to not be hypervigilant and focus on every single thing that's not just happening in your environment, but also that's happening within yourself. Good stress management absolutely prioritizes sleep, but also exercise, trying to find that perfect balance of restoring and taking in, but also expressing and letting some things go. Please talk to your doctors about these symptoms. If they are bothering you, then you deserve a workup, okay? Very important to me that you feel like you at least understand this a little bit better and can take some action steps to try to get it out. Don't let it bother you anymore with the right tools and medical partners. So please, right here on this Facebook Live, tell me, when did your tinnitus start? Is there anything that helps it? Is there anything that seems to bother it? Tell me if you're going to do anything different from this lecture tonight. Are you going to go see an audiologist? That's what I absolutely care about most, is that this information really makes a difference and makes you feel less alone and that you have a map and some guidance. If you haven't joined us for Brain School yet, I would love for you to come to the next webinar. It's on July 8th. You can sign up at our website. The workbook that you're going to get with this one is one of my favorites. We talk all about how do substances affect the aging brain. So I go into some more prescription medicines that you need to know about, over-the-counter medicines, vitamins, supplements, food. We talk about the mind diet in detail. It's probably the lecture I have gotten the most positive feedback from the thousands of folks who have taken it with me live here in North Carolina. Now we are opening it up to the world on these Zoom webinars. I am so happy to have you here, and it is just a wonderful feeling knowing that we can all connect here on Facebook every Wednesday at 6 o'clock. So please let me know what you think. Share this information far and wide, and I will see you next Wednesday. Take care, everybody. Bye-bye.